Yemen, a nation ravaged by more than a decade of conflict sparked by the Houthi rebels, is now confronting a deepening crisis as seasonal rains have declined by up to 40% in certain areas this year. This report has more.
A leading global aid organization has issued a stark warning about Yemen's worsening water crisis, where access to clean drinking water is becoming increasingly scarce amid war, drought, and funding shortages. The Norwegian Refugee Council says that around 15 million people in Yemen are struggling daily to secure enough safe water, a situation made even more dire by sharply declining rainfall and damaged infrastructure caused by years of conflict. Yemen, a country devastated by over a decade of war ignited by the Houthi rebels, now faces an increasing crisis as seasonal rains, which normally replenish water supplies, have dropped by as much as 40% in some regions this year. This drastic decline leaves millions without reliable access to safe drinking water or sanitation, affecting not only drinking needs but also hygiene, disease prevention, and agriculture. Angelita Carreta, Regional Director for the Middle East and North Africa at the NRC, explained the vital role of water in sustaining life. She said water is essential for drinking, hygiene, health, disease prevention, crop irrigation, and livestock care. Safe water has become more scarce than ever before. The rising cost of water is forcing many families into impossible choices. In the southwestern city of Taiz, the price of 1,000 liters of water, enough for cooking and washing, has climbed to nearly $5, about a day's wage for many workers. For those who cannot afford it, women and children often make long and dangerous journeys to collect water. In Abyan province, a displaced woman shared her daily struggle, walking 3 kilometers to fetch water from nearby farms, often carrying it on her head. She described heartbreaking scenes of children falling from donkeys and spilling their precious water. The crisis has led to a rise in water-borne illnesses, such as kidney disease among displaced populations. Despite efforts, humanitarian funding remains critically short. Only 10% of the required funds for water and sanitation projects in Yemen have been secured, leaving millions without essential support. With Yemen facing one of its driest years in memory, the need for clean, safe water has never been greater. The international community is urged to step up support before the crisis escalates into a full-scale catastrophe.